This is an overview of the application BiliCalc.
BiliCalc is an application that will calculate the risk for neonates that have jaundice. It takes the age and hours of the infant and the risk factors to assess the need for intervention. Many neonates develop jaundice in the first few days of life. Jaundice is caused by immature livers and a high level of bilirubin in the infant's bloodstream. Some have higher risk factors and need to be closely monitored. Jaundice in infants is caused by an immature liver that is unable to quickly remove bilirubin from the bloodstream. Risk factors for jaundice infants include a different blood type than their mothers, prematurity, and bruising, and that can all contribute to an infant becoming jaundiced. Many infants have some jaundice, however high levels of bilirubin can have serious complications including brain damage. Acute bilirubin encephalopathy symptoms include a high-pitched cry, lethargy, fever, and kernicterus. All infants should be screened prior to discharge home from the hospital for high levels of bilirubin, and they can do that by using a transcutaneous bilirubin meter. If an infant has a level over the 75th percentile, then a blood draw must be done for accuracy.
The application is easy to use. You enter the baby's age and hours along with the lab results, and the recommendation is given. On the left is the main screen. On the right is information that has been entered for, as an example, where the bilirubin level is 13 and the infant's age at time of lab draw was 24 hours. And in this case, the infant is in need of phototherapy.
An additional tool that's included in the app is the American Academy of Pediatrics nomogram, and it shows the acceptable levels in infants for the hours of age. For example, a lab level of 6 places an infant that's 20 hours of age in the high intermediate risk zone. However, the same lab level is a low risk for an infant that's 36 hours of age. This graph is easy to use and helps the healthcare professional adequately manage the care for hyperbilirubinemia. This application is easy to download from iTunes and it costs $1.99. The application is intended for healthcare professionals such as pediatricians, neonatologists, nurses, and medical students. The application requires the iOS 6 or newer, but once you pay for it and download it, it's immediately available for use. Another advantage to this app is that there are not any privacy concerns. There is not any personal information that is used in the app. Even if your handheld device is lost or stolen, the patient's privacy will not be compromised. The only information that the app uses is the age and lab values. I would recommend the use of the BiliCalc. It gives quick results. The app is based on the American Academy of Pediatrics recommendations, and the American Academy of Pediatrics guidelines include the use of a risk assessment tool at the bedside. Many healthcare professionals in the hospital setting do use this app or a similar app. It's easy, it's quick, it's portable, and the information is easy to read.
When infants are affected by hyperbilirubinemia, proper treatment is imperative to prevent permanent brain damage. BiliCalc can be a tool to help provide proper treatment for those infants.